Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Want to welcome everybody on a record hot heat day here in Providence. Supposed to come close to 100 degrees as this heat wave and really spectacular weather continues. But please stay safe and pay attention to your health if you're out in the sun for an extended period of time. No Governor Raimondo. She'll be on tomorrow afternoon at 1 o'clock. And this afternoon at 2 p.m. we'll have the head of Providence Country Day. He'll be talking about their plans for the fall and what their challenges are, both for being in classroom and augmented with online. Let's go to Dr. Michael Fine. Dr. Fine, thank you so much for joining us.
Great to be here, Josh.
New numbers are out today just about a minute or two ago, and they are not good numbers. Can you walk us through these Rhode Island case numbers?
Sure, but remember they're only one day's numbers. So new cases 119, the first time we've broken 100 in over a week. But again, I don't know how much of that was sort of pent-up demand from over the weekend. 68 people in the hospital, down a little bit, but the overarching trend is quietly up, and 10 people in the ICU. That has doubled. It's actually gone up by a factor of 5 over the past 10 days. It's still small numbers, so that factor of 5 stuff probably isn't that significant, but the fact that it's going up is significant. And unfortunately, one death overnight, for a total number of deaths of 1,005 in Rhode Island.
So what we've seen since July 4th weekend, that 3rd, 4th, and 5th, where we saw the lowest number of new cases averaging around less than 30. I think one day was 20, another day was 23 during the course of that weekend. We're now jumping back up a 5-fold increase. We're now in the hundreds on a regular basis in the past week or so.
I don't think you could say in the hundreds on a regular basis. This is the...
You had two days last week and then again today. And
yeah.
Testing still isn't consistent. Yesterday was not a bad testing day. It was 3,700, but it's not at this 4,000 and 5,000, and it's certainly nothing compared to what the governor had promised, that we'd be pushing towards 10,000 by the end of August and 20,000 a day by the end of September. Those plans have functionally been abandoned. We're seeing these professional sports teams who are doing testing almost nonstop around the clock. They have more access to testing equipment than anyone else in the country, and they can't keep their players playing.
Yeah, well, the problem isn't the testing, the problem is the disease. This disease is spreading, and it's pretty clear that it's spreading in Rhode Island, that it never really stopped, but it's spreading more than it was. It's not anywhere near as bad as it was, or as common as it was in April and May, but it's still out there and it's spreading. It hasn't gone away.
Whether you want to count it, I think what's the 3-day average, around 90?
No, I think it's still in the 7 of new testing. I think it's
number of positives per day on a 3-day average.
Yeah, I think it's, I haven't seen today's 3-day average, but I think it's still in the 70s when I look back over the last 3 days.
What does this point to?
Well, it points to that the disease is still here and still spreading. Remember that the CDC estimates that for each positive case we see, there are 10 we don't see. So that means we're probably looking at 700 to 1,000 people who are getting COVID every day. It points to our desperate need to invest much more robustly in slapping this disease down. We just haven't brought, our full game to the table, and we got to get that game on the table before we get beat again.
This weekend, we've discussed it, but a little more data. There was a positive case at the snack bar at the DEM venue down at Scarborough South. One employee tested positive, another one did not. They closed it for 1 day. It was back open. The department said that they don't know if any of the customers were, tested positive and don't have a way to track them. So is that the right amount of time to be closed? A one-day closure? Obviously, they treated the facility, but is that enough time to sort of make sure the venue is cleaned up?
Well, first, venues don't have the virus, people do. And the problem isn't what's on the on the table. The problem is what's in the air. That said, I think most public health people would say if you have a single person who's ill and then test everyone else in the facility, you probably are okay not to close, just to disinfect. But should you get two people who are ill inside 2 weeks, two people who are positive, my sense of the world is that that's an outbreak, and then you should close for 3 weeks.
This morning, we have a comprehensive piece on nursing homes and the battles that's raging there. Friday, we'd broken the story about the number of cases that spiked at Bannister House in Providence. 26 have been identified as being positive. There's still some test results waiting. There's a lot of complexities to nursing homes, but one of the numbers that sort of stands out is about 60% of the work that's done in the nursing home is done by folks, primarily CNAs, certified nursing assistants, who start at about $13 and make upwards to about $15. That's the front line, is an extremely low paid worker in these nursing homes, giving cares to people who are rehabbing and folks that are concluding their lives. Is this the way to run a railroad?
It has never been the way to run a railroad. Listen, if you've ever been and spent any time in a nursing home, these CNAs are people with amazing hearts. They care about the people they take care of. They put their heart and their soul into these people as if they were family. And we let them survive on $13 an hour. We shouldn't have been doing it at the start of this, and we shouldn't have been doing it 30 years ago. These are people who need to be paid $25 an hour, who need to have a decent life, who need to have a career ladder, and need to have our thanks and support every day of their lives. And we keep abandoning them and expect that we're going to get a hugely good result with no investment, exactly like what we're doing with COVID. And guess what result we have? The result we have is a pandemic that will kill 250,000 Americans at least before we're done.
Mr. Marin, the head of the SEIU chapter here in Rhode Island, who represents the nursing home workers, said that the ownership group that they're negotiating with for a new contract has offered a 20 cents per hour increase in wages. That seems like a fairly low amount considering the work environment in which people are being subject to. 20 of the workers at Bannister have contracted the pandemic, and one employee, the receptionist, who was 65 years old, passed away from an illness related to the disease. There's an effort to increase the staffing via state law at the General Assembly. The Speaker of the House seems to have killed it over on the House side. Are we going to run the risk of people just no longer being willing to work in these environments?
Well, the problem is we have limited people's opportunities, particularly people of color. So there's no other place for people to work. We haven't given them enough people educations to give people another choice. So we've created, this situation that once was called something like Northern slavery. We've done this, and this is one moment where I don't think you can blame the nursing home operators, because their rates are set by the state. This is something that the state can and should fix, and this is something the state does, hiding behind sort of layers of different kinds of outsourced and corporate ownership. This is us. It isn't them.
Yeah, I will point out that the parent company, New York companies, had problems around the country on a number of issues, and they are able to pay for a sponsorship with the Buffalo Sabres hockey team. So I'm not sure they are exactly counting every penny over there. They seem to have money for certain aspects of the corporate life and maybe less so for the workforce here in Providence. Let's jump over to case rate. Describe, we talked a little bit about before we came on about the difference between the case rate versus sort of the per capita when it comes to how deadly this virus is. Talk about the difference. That number is getting kicked around in Washington a little bit now.
Yeah, it's really interesting. I mean, I saw a letter from Pete Gaynor, who's now the federal director of EMA.
FEMA, yeah.
FEMA, I'm sorry. Who's a good guy. And in the letter, I think he said that the mortality rate has declined by 80%. And I started thinking about how he could have gotten to that number when the total number of deaths keep going up. And what I think he means is the case fatality rate, which means the number of people who have tested positive, the percent of the number of people who tested positive who go on to die. But that has become an almost meaningless number, though it was a number we were really fixated on in the beginning of the pandemic. And it's become meaningless because of all the asymptomatic testing we're doing and all the different state by state in how much testing we're doing and who gets tested. So at the end of the day, the denominator is so variable that you can't make a meaningful conclusion about the number itself. So yes, the case fatality rate probably declined, but that was only because we started testing many, many more people and finding many people who were positive but had almost no significant disease or asymptomatic. What is more important is what I'll call the population fatality rate, the proportion of the population that has died from this disease compared to other diseases. And I ran that last night and found what to me was interesting, because I struggle, I think like everybody else, with the question of, is this really a big deal, this disease? I mean, a lot of people get it, a lot of people get trivial disease, who cares in a certain way? But what I found was that the Rhode Island COVID-19 death rate is 2.5 times the United States COVID death rate. So in fact, we are doing worse, at least on the front end, though most of that probably has to do with the number of people who are over 85 in Rhode Island. And I suspect the United States is, particularly in the Southeast and Southwest, working very hard to catch up, unfortunately. But the other thing I found that was interesting to me is that the Rhode Island COVID death rate is now 5 to 10 times greater than the yearly U.S. Influenza death rate. So is this worse than flu? The answer is, you betcha. 5 to 10 times worse so far, and we're not done yet.
Rhode Island continues, no matter how you cut the numbers, to have the 5th highest per capita death rate in the country per 100,000 residents. So that's certainly an equalizer across the country. And of course, we have either the first or the second highest number of deaths tied to nursing homes. About 80% of all our deaths here in Rhode Island are related to congregate care, either nursing homes or other forms of healthcare driven group homes.
But the highest number of people at risk because of the number of people who are over 85 in Rhode Island, where we have the largest percent of that population in the country, I believe.
Yeah, so, we see this spark back up at Bannister House. Is this cycle just going to continue? It'll be Bannister House this week and someplace else next week. And by the way, this wasn't the first time this has hit Bannister House. The head of the union, by the way, told me that at the beginning of the breakout, they couldn't access PPE. It was locked up, and the parent company would not give them access, would not unlock the PPE because they didn't want it to be wasted.
I mean, just to say that you would be wasting PPE to protect your workforce is, if true, a very painful observation indeed. Is this going to get worse and affect other nursing homes? I think it's a function of how much disease there is in the community. You know, in places in Rhode Island where there's almost no disease, I don't think those nursing homes are at huge risk, but some risk. But in places where there's lots of disease and lots of staff who come from those places, I think it's going to be very, very, very hard to keep all nursing homes free of disease, despite how hard everyone is trying. And I know everyone is trying with every, sort of ounce of their strength. But this is just too tricky a disease. Remember, testing helps a little bit, but there are still lots of people who will have the virus and test negative. And so how do you know at the end of the day, unless you take every single person who, before they go into a nursing home, isolate them for 2 weeks before you let them go in and test them a couple of times during that period. And even then, it's not perfect.
This is an unfair disease, especially for those with high levels of income, can make much different decisions than those who have to go work in a nursing home. Maybe the most demonstrative example of this is 5 members of the New England Patriots have announced they're opting out of the season. 2 of them are expected to be new dads. The other 3 just didn't want to risk their health and decided not to play. Is that the prime example of the 2 worlds we're living in America?
Yeah, it is a prime example. And it's an example that we need to confront over and over and over again. Think about all the people who used to live on the Upper East Side of Manhattan who vanished. I think there are 80 to 100,000 people who are not in New York. They're out in their country homes staying safe. We do not have equality of risk, and we certainly don't have equality of safety.
Dr. Michael Fine, thank you as always. For everyone else, stay tuned. 2 o'clock, the head of Providence Country Day. A number of updates coming up this afternoon. We'll have a significant story coming up shortly. Stay tuned for the e-blast, should be going out. And for everybody, please stay safe, wear your mask, and enjoy the great New England weather. Thanks so much.
Thanks, Josh.